Percy Health's webinar this morning. Um, my name's Matt Brown. I'm the medical director at Percy Health. I'm also a pain consultant working in a cancer centre in London. And we're hosting a webinar today exploring a really pertinent and topical subject, and that's cancer in young people. And we've called this webinar Generation Risk. And what we're going to do today is, along with a fantastic panel of experts in the field of oncology, really delve into this subject. And the reason that we're presenting this today is that Percy Health has just published a report based on a big piece of survey work we did in young people around the perceptions and the understanding of cancer risks and screening. We're bringing this to you today in partnership with Macmillan Cancer Support, who are partners with Percy Health. So I'm going to just move along to the panel that's joining me today. Sarah from Healix Health is running slightly late, but she's going to join us imminently. And what I'll do is I'll ask my two panelists to just introduce themselves to you. So Lisa, over to you first.
Thanks. Good morning, everyone. So my name is Dr. Lisa Dvorjetz, and I'm a counselling psychologist working for Percy Health, but also I hold roles in the NHS and in private practice. So doing some work working with people that have been diagnosed with cancer and their families.
Brilliant. Thanks for joining us today. I'm really looking forward to hearing your thoughts on these subjects. And Joanna, hi.
Hi, good morning, everyone. I'm Joanna Injore. I'm an oncology dietitian and a dietitian at Percy Health. I also work in private practice and I also do some work for Macmillan Cancer Support too.
Brilliant. When Sarah joins us, I'll ask her to introduce herself. So, what we're trying to do today with our panel is have a real multidisciplinary flavour, looking at both clinical aspects of cancer in young people, but also having Sarah involved, looking at the sort of employer and employee perspectives, which is going to be really interesting as well, I think. So firstly, a little bit about Percy Health and what we do, in case you're not aware. Percy Health is one of the UK's leading virtual cancer clinics. It provides care, support, and detection screening services all the way across the cancer journey. It's unique in the fact that it's a hybrid model with real people, real professionals across the whole multidisciplinary team, addressing all of the areas of unmet need that we encounter in people living with and beyond cancer. You can see here that the expertise, and it really is expertise of the professionals working with Percy Health, spans a huge array of different areas of clinical practice, from psychological support all the way through to things like menopause and physical fitness and exercise oncology. So a really impressive array of different professionals. In the UK, we're faced by a really pressing and quite shocking level of unmet need in the oncology setting. And this is becoming more and more pertinent in younger people. There's been an 80% increase globally of people under the age of 50 being diagnosed with cancer. About a third of cancer diagnoses occur in people of working age. And we're also seeing real advances in the way that cancer is detected and managed. And this is leading to really quite impressive increases in cancer survivorship. So for common cancer types now, we're seeing 5-year survival rates of around 90%. And what this means is that globally, we're seeing a huge increase in people who are living with and beyond cancer. And it's projected that there'll be 100 million cancer survivors globally by 2040. In the UK, we're facing a number of challenges in the oncology sector, I think it's fair to say. And it's really interesting when you look at cancer that there are huge areas of lifestyle that can be modified to mitigate risk. 40% of cancers are preventable by simple lifestyle modifications, diet, exercise, etc. We're seeing across the population a lack of engagement in screening. A third of screening appointments are missed, according to NHS England data, and this results in later diagnosis. So only half of cancers are diagnosed at stage 1 and 2, and this impacts directly on outcome. We know that the earlier cancer is detected, the better the outcomes. And we're still seeing patients in the UK being diagnosed having presented to A&E as emergency cases, for example, with bowel obstruction due to a bowel cancer that hasn't been detected. We're also relatively slow in taking a patient from diagnosis through to treatment. And according to Cancer Research UK data, a third of patients wait over 2 months from referral point to commencing treatment. And what this results in the UK is that our cancer survival rates are lagging behind those seen in other comparable economic and healthcare systems across the globe. So why do we miss our targets in detection in the UK? I think Sarah's joining us. There we
Hello.
go. Hello.
Hello, sorry about that.
That's quite all right. Sarah, do you want to just introduce yourself and say hi and who you are,
Yes,
etc.?
thank you, Matt, and apologies, everybody. Tech issue there. So I'm Sarah Taylor. I'm Director of Corporate Proposition at Healix, and I'm delighted to join the panel here today to talk about how we can make changes to how we support young people in recognising the signs and symptoms of cancer. So thank you, Matt, and looking forward to hearing the debate.
Brilliant, thank you. I'm just doing a sort of intro to the subject, so I'll carry on with that, and then we'll get down to the sort of meat of the matter in a second. So just looking at why we're missing our detection targets, as I've said before, we're seeing less engagement with screening programs that are existing. Why is this? Is it because people don't understand what screening means? Is it because people don't know how to access those processes? We're seeing growing pressure across the primary care setting with access to primary care physicians, etc., and primary healthcare. We're seeing a reduction in health literacy across the population. So reductions in understanding of what signs and symptoms are for cancer. And sadly, a growing gulf between the most affluent areas in our population and the most deprived areas. And there's really striking differences in outcomes between the most affluent areas in the UK and the most deprived. So Perci Health worked with a market research company to undertake quite an ambitious piece of work, surveying 2,000 young adults across the UK. And the aim of this work was to explore young people's understanding of cancer, the risks, the process of screening, but also to understand further young people's perceptions of the roles and responsibilities that employers have to their employees in this area. Some of the sort of take home messages from this work, and the report will be circulated to everyone attending this webinar by email afterwards, and I'd really encourage you to read it. It's very well written. The take homes from this work are that many young people lack knowledge about key cancer risk factors, predominantly young men. Despite a huge amount of effort in cancer education, it seems to fail to reach young people. And it's interesting to see that despite the work that's been done historically, it doesn't seem to be hitting home with young men. And what this is leading to is this population are uninformed, or even worse, are actually misinformed by information that they are accessing, often through unvalidated sources on social media, for example. And also that young men and women feel that their employers do have a duty of care to them to raise awareness around cancer risk, improve education around what can be done within their lives to reduce that risk. From our report, we've evidenced that young men's understanding of risk is poor. It might not come as a surprise to you, or it might be a surprise, but 2/3 of young men, do not link smoking to the risk of developing cancer. 3/4 of young men didn't recognize high alcohol use as a risk factor for cancer, and 3/4 of men didn't understand that a poor diet increases the risk of developing cancer. And 14 to 15% of young adults didn't believe there were any cancer risk factors at all. So quite striking figures. They also felt that cancer education does have a role in the workplace, and that the workplace is a setting where they felt that discussion and information and education around cancer risks and detection would be appropriate. And I think that's a really interesting concept, that an employer has this a duty, a responsibility to their younger employees to actually be increasing knowledge around this area. So what we're going to do now is expand the conversation a little bit, and open this out to the panel, and we're going to do it in a relatively structured way. And what I'd like to sort of focus in on to start with are some of the tumor types that we encounter in Perci Health. And I'd like to just start by talking a bit about young people and bowel cancer. And we're seeing an increase in the incidence of bowel cancer amongst younger people. And there really are some questions around why this is happening. There's been a lot of interest in the role that the microbiome and gut health can have on the risk of bowel cancer. And Joanna, I'd love to hear a little bit more about that, a bit of an explanation about what those terms mean, and what we're seeing in that population.
Yeah, thanks, Matt. I think there's a lot of talk about gut health and the gut microbiome, and it's hard to. It sounds quite an objective thing, so it's really good to kind of have a bit of a definition of what it means. Um, Basically, the human microbiome is a collection of microorganisms. It's bacteria, it's fungi, it's viruses and genes that all live not only just in our gut, but actually also in our skin and our mouth. And these microorganisms are very small, they're very tiny, but actually make up about 1/3 of our total body mass. And there's a lot of interest in how maybe these gut bacteria can interact with our health positively and negatively. So I think there is a bit more interest in sort of colorectal cancer and gut health, obviously because of that area that's affected by cancer. And also this shift that we have with our modern diet. I think our modern diet now has really moved away from whole foods. And we know that many people in UK, many younger people are eating less fibre. And we know fibre is something that helps to promote good, healthy gut microbiome. And if maybe our younger populations and us in general are eating less fibre and possibly having, cooking less from scratch and, because of having a busy lifestyle, it could possibly have an effect on sort of how healthy our gut microbiome is, and its influence on sort of cancer risk.
Lisa, talking about bodily functions is always hard, and from a sort of behavioral and psychological perspective, do you think that there are barriers in younger people to going and talking to a healthcare professional about the symptoms they might be getting?
Definitely. I think, there's a lot of fear, shame, embarrassment when it comes to talking about bodily functions, and also, I guess, thinking about the cancer sites as well, thinking about prostate, thinking about, yeah, whether it's a gynecological cancer as well, there's definitely barriers in terms of people reaching out and feeling confident in having some of these conversations, because I suppose if you're not used to having the language growing up or talking amongst friends, then it's almost like not knowing where to start with it all.
I think one of the things, I'm sure everyone's familiar with Bowel Babe, but a lot of what she did was around trying to break down the sort of barriers about talking about your poo, etc. And I think th those sort of bite-sized educational bits that really sort of hit home are so powerful, aren't they, to get that message
Definitely.
across.
Definitely. And I was going to just add that I think also, there might be a bit of a perception that that younger people may have, that this isn't a problem for them. Like they could have it, a change in bowel habit is okay. It might just be IBS, it might be something I've eaten,
Yeah.
rather it being sort of something more of like a cancer possibility. So I think there is that kind of perception really, maybe in younger people, that it may not be a big of a problem as it could be, in that awareness.
And Sarah, we've talked previously around the sort of roles employers play in facilitating those discussions around, what are you doing about your health as an individual, and what are your thoughts on that?
My home device, and I have my cows in the back for some bizarre reason. And it's been such a tech nightmare this morning, I'm not going to try and move them. I think what's really interesting is, as an employer, we probably have the biggest opportunity to engage with young people.
Mhm.
And I think that what the research that Perci has shown us is that, as you said, Matt, individuals think that the employer has a responsibility. And, we engage with people as managers, we engage with people probably once a month through a one-to-one. And is that the opportunity that we start to take a responsibility to talk to our employees about their general health and well-being, take a much more holistic approach to one-to-ones? Because I think one of the things that's a challenge is that as an employer, we will tick box the health and well-being app. We'll assume that everybody interacts in the same way. And of course, we know that they don't. So it's how, I think, first thing is taking those opportunities to have that discussion and find out how our employees are, which is the first thing. And then I think the second thing is about making sure that the resources that we use actually meet the needs of a very variable population. As I've just shown, being almost a baby boomer, but not quite, technology is not my comfortable place. So a quill, much better for me.
The I think the signs and symptoms of a lot of cancers in young people may be slightly different as well
Mm,
from what is being,
mm,
the sort of big take home messages and that are publicized. And again, with an employer, that you've got that opportunity
yeah,
to really target what
yeah,
you kind of
yeah.
saying to an individual.
And
And
sorry, Matt, go on.
no, no.
Well, I think there are two things for me. Number one is, there was an initiative back in the day in the NHS, which was called Make Every Contact Count. And I remember being a clinician and being obligated almost to seek out and ask people more about their general health. Now, we
Yeah.
know on our book that where young people, and in particular young men, interact with us is through MSK problems. So actually, what I would like to see in the future is that, as a purchaser of healthcare, I am obligating people to have those broader conversations, to talk about diet, to talk about sleep, and all of those things, and to start to talk about, well, what are the signs and symptoms that you should be checking out? Because somebody's almost a bit in the place to listen at that point. So I think that whole initiative of Make Every Contact Count. And then I think the other thing from us as funders, how do we make sure that, thinking about Jess's rule, and if you've been to the GP 3 times with the same symptoms, reach out to Perci Guide, which obviously is available across all of our book now, but reach out to Perci Guide, or reach out to your funder to say, look, I've been to my GP 3 times now, I'm still suffering. we can then enable people to take the necessary steps and actions to get those symptoms looked at and get them sorted. And of course, we do know that there's the VGP service, and I was delighted to see that last year the incidence of young men reaching out to the VGP service did increase. It sadly plateaued back down again, and it's now about the same level as women. But how do we make sure it's anonymous? And it seems to me that a lot of young lads don't want to speak to someone sitting in a sort of rather, crusty consulting room. Those are the sort of things that perhaps we need to change our messaging.
Yeah.
Give people the opportunity. This is here for you. Please reach out.
Yeah, I think it's funny, isn't it? Because I think healthcare probably is the only sort of point in someone's life where you still actually have to physically go and sit, like you said, in a sort of slightly fusty room with a desk and a person. There's no other engagement really in life now where there is that sort of interaction. And I just wonder, I mean, Lisa, from a psychological perspective, what do you think for younger people, what are the barriers to actually accessing the resources that are there at the moment?
Oh, where to even start with this? I think, Matt, you mentioned some of the factors earlier on in the presentation, but I think we're looking at so many different context levels when we're talking about this. We're thinking about on an individual level and thinking about, well, what are some of the intersecting identities that people hold that might be a barrier in and of themselves? So, for example, if we're thinking about race and ethnicity, we know that people from Black and South Asian communities, they are marginalized in society, and therefore there is a long-standing history of mistrust in healthcare professionals. I think, that's a huge barrier in and of itself. We know that a lot of trials, a lot of studies, haven't factored in the different races and ethnicities in their participant groups to begin with. So a lot of the research just isn't focused on these groups either. So there's a lot of ongoing discrimination. There's a lot of structural inequalities that occur. And so, we're facing huge barriers around that aspect of healthcare. But then thinking, again, not just on an individual level, but thinking culturally and from a religious perspective, there are certain cultures and religions where talking about cancer is a massive taboo.
Yeah.
There's links to, I suppose, people feeling like there's some kind of curse if they've been diagnosed with cancer. And so then that's going to be a huge barrier in terms of then people talking about it amongst their friends, amongst their family, because there's a lot of shame attached to it. There's a lot of exclusion then because of how it's viewed. And so, I think thinking structurally as well, cultural, societal levels, those are some of the big barriers that we're currently facing with the population.
And it almost becomes a self-fulfilling prophecy in populations where by not accessing existing resources, you present late, and then often the outcomes are worse, and it sort of feeds in on itself, doesn't it, in a way? I think it's really striking when you look at things like detection of prostate cancer in certain populations being delayed, leading to worse outcomes. And I think for digital health platforms, they actually have a real opportunity to target those populations in a way that's very thoughtful and accessible to try and reduce that kind of disparity. And I guess going back to employers, they again are in a very good position because they're reaching a much broader cross section of society in general, aren't they?
And
so I was just going to add, in terms of like employers, I guess it's also thinking about what, apart from conversations, is what else can be done, like to create this sort of healthier environment. Even just like simple things about, encouraging time to take break time so that you go for a chance to have a walk, or even like when you have an event, rather than being sort of more, alcohol free, or sort of healthier opportunities to kind of get together. I guess that could be promoted as well with employers. And promoting those healthy behaviours.
I think that sense of always on within the workplace, prior to the pandemic, you never had, I never heard the phrase back-to-back meetings really before the pandemic. And now it's assumed that you can just sit from 8:30 through till sometimes probably 4 o'clock, meeting after meeting, not recognizing that actually as human beings, we do need that space. And that goes back to a lot of the issues in the workplace, I think, are caused by the cultural setup of the workplace. And then we all know that those are the things that lead to stress, all of those risk factors that then impact on physical health and all of those other good things. So I think, yes, the clients do have a responsibility as to what is the culture of their workplace that helps people to look after themselves better.
I think following on from that, something that I hear quite frequently in therapy sessions is employees not feeling like they've been given the permission to take some of these breaks. I think depending on the culture of the workplace, there is a sense of, oh, well, you eat at your desk, you can't leave it, you can't go out for that break. Whereas actually, I suppose if we're thinking about some of the narratives and the permission given to employees and sort of encouragement almost to do these things, I think that will be really helpful.
And I've always wondered, and I've been thinking about this increasingly more recently, we set our objectives at the beginning of the year, but is there anything in there about health? And perhaps that's a way that we can encourage people to take more responsibility, to do some of this stuff, is to say, well, actually, it's bound into your objectives, because your wellness and your well-being, the more, well, that doesn't sound very good English, but the healthier you are, the better you are and more productive you are as an employee. So it makes sense to me that an employer should be thinking, but tasking that as part of your objective so that you will do it, because your pay review or your bonus might be tied a little bit to it. Now, I don't know where that sits legally, but it just sort of makes sense to me that health is so important and we should invest more time in it.
I've always been amazed by, if you look at a professional sports team, the amount of resource that's expended on looking after the asset, which has an inherent value to the organization, versus what most employers do, which is essentially sweat the asset and not look at how
Matt.
well they are. I'm always totally bamboozled by that.
Well, it's so interesting you bring that up, because this week I was at an event sponsored by HCA, which was the League Managers Association event.
Okay.
And they had elite people who work within elite sport feeding back how this could then be picked up within a business. And you're absolutely right. All of the things we're talking about today, which are so focused on to get that absolute tip-top performance out of an athlete, have a place in a normal working environment as well.
I'm going to change tack. And one of the things that the report highlighted was, and I was really surprised by this, but the increasing use of sunbeds and skin cancer risk in younger people. And this seems to be driven by sort of concerns about appearance, wanting to look tanned on sort of TikTok, social media, etc. Lisa, what are the pressures that people are feeling?
Oh, massive
That's driving
pressures.
this?
Yes, I think, with the increase in social media platforms, like you were saying, people's lives are constantly available to be seen, and therefore there's a huge sense of peer pressure or wanting to fit in. There's also quite an emphasis, at least in our Western society, around youth and youthfulness. And so I suppose that adds into it as well, thinking about, well, what is the newest trend? And I want to be as a part of that trend. And so wanting to keep up with it. And I suppose quite often, especially with young men, but young adults in general, there's a sense of omnipotence. It's almost like, oh, I'm not going to think about mortality. I'm not going to think about cancer. That just feels so far removed from my current life. Not thinking about it, as opposed to that instant gratification and that sort of thinking about the here and now. So there's a massive trend differences, but then obviously there's going to be health implications by using more sunbeds, by being out in the sun more and not taking those precautions to minimize the risk.
Reading the report, it made me think about young people not putting money into their pension either because they can't, it's almost like they can't
Yeah.
visualize being old. And
Yeah.
Too
yeah,
far
and it's a
away,
similar thing,
maybe.
isn't it?
Yeah.
That, you know, I can't really, it's not tangible. I can't see myself at 60 or whatever. And I don't know, how do you kind
But
of make people
that
perceive that?
that's interesting though, Matt, isn't it? Because employers have to put
Yeah,
money into a
yeah,
pension.
yeah.
And you know,
And
that's
that's
saying,
been
right, well, I'm going to
legislated now,
invest
hasn't it?
in my future financial
Yeah,
health. Where's the same impetus? I'm going to
yeah,
invest in my physical and
yeah,
mental health.
yeah,
So that's equally a good question, isn't it? Why is it treated differently?
But I think
yeah,
also if we think about, socioeconomic status and, quite often at the moment, people are struggling financially, even
yeah.
if they do have jobs and even if they do have healthcare provided for them via their employer, there is a sense of needing to have all of that additional cash that isn't really spare anymore. It's more about survival. And so we can't necessarily think about the future if we're in survival mode in the present.
No.
So it's hard when there is a financial implication.
And Lisa, I'm picking up on that because I think that's a really interesting point because ultimately everybody has to pay taxation on their healthcare benefit. Now it's our responsibility and it's the employer's responsibility to make sure that they manage the fund responsibly. I mean, obviously, I come from an organisation that manages corporate trust funds. It is that we have a responsibility not just to the trustees of the fund, but also to the individuals, because if we don't take control, and it's almost a vicious circle, because if we're not catching these cancers early, then they become more costly. And it's all
Yeah.
this sort of virtuous circle. But if we allow the cost to escalate, that's going to increase the cost for those individuals that we actually really want to have this, which is the youngsters, who then, to your point, can't then afford it because the BIK payment is too high. So again, that responsible fund management, that getting things early, that making sure that we treat things when they can be treated quickly and not cost us lots of money, are absolutely an imperative to make sure that we treat that consumer fairly and responsibly as well.
We've touched on sort of informational gaps and misinformation, and certainly in clinic when I see patients, there seems to be a big interest in diet and supplements. And Joanna, what are you sort of seeing in this space?
Yeah, I think I think with nutrition, it's everywhere. And I think because, and especially on social media, and if you're thinking about the younger population, a lot of them are getting a lot of their health information from other sources like social media.
Yeah.
Um, if you look on TikTok or YouTube or Instagram, they are just full of people giving advice. And it's often very sensational messages. So, and we know the algorithm will always kind of prioritize these kind of really sensational messages and very incorrect most of the time, to be honest, information, and then that kind of just feeds that algorithm, and then people who have maybe shown interest in things like this, they'll get repeatedly shown these messages, and unfortunately, they're often incorrect messages. So it does lead to this misinformation. So actually, I find in clinic that I'm often myth busting, and people raise and ask me all of these things that they've seen online about whether it's true or not. And unfortunately, healthcare professionals' voices often are drowned out by these sort of influencer model and content. So I think really thinking about if we were looking at giving information to younger generations, we really need to reach people in a different way. I think we need to communicate in a different way that kind of makes sense to them. It's visually appealing, engaging. It's bite size. It's what people are seeing in their everyday life. But I think that's how we kind of need to make it make sense for them, really.
I think that's one of Percy Health's strengths, that
Mhm.
it's presented, the information and the support is presented in a way that is much more accessible, with a focus on experience alongside being validated and high quality. And I think that Percy's a real leader in developing those kind of services. Um, I think, but what to me, it's really interesting because especially with sort of diet and supplements that there's obviously good stuff there, right? And there's very relevant stuff, but it often just gets drowned out in like a sea
Definitely.
of goo that you
That's
just
right. I mean,
got
it's like
no idea what's
fiber,
going on.
for example. Fiber is one of the things that we should be promoting, but
Yeah.
it's really boring, isn't it? It's not exciting to talk about fiber. So some people
Well, I don't
will,
know.
that voice is kind of drowned out,
Yeah.
and the more interesting things, or like take a supplement pill, something that's easy and quick, which is we
Yeah.
know is how we live our lives now. It's very fast paced, so it feels easier to go for something quick rather than sort of investing in thinking about how we can increase our fiber. And it's the way it's presented as well, I think. I think it's how we present that information. Um, and if it feels too difficult and complex and expensive, it's going to be something that people are not going to want to do. But if we make it practical, and accessible and relatable, I think
Yeah.
that's how we get the messages across.
And the sort of psychology of behavioral change. I mean, it's almost like a societal thing, isn't it, Lisa, that we're talking about?
It is, I think going back to what I was saying earlier on, you've got sort of individual behaviors that can be changed, but there is also a huge societal and cultural narrative that needs to be changed. And it was interesting reading that report as well, saying that I think previously people would prefer to get information from their GPs.
Yeah.
I think they would go, whereas now we know that people aren't accessing GPs as often, and you can also obviously have the 15-20 minute consultations with a GP provider online, and you can just book it that way as opposed to going in person, receiving a leaflet. All of those habits are starting to change. So I think we are needing to keep up with the demand from clients, from individuals, of how they are consuming information, like Joanna was saying.
We're coming to the end of the webinar. I think there may have been some questions posted from the audience. I'm just going to have a look. Let's just check with our producer. Have we had anything through? Doesn't look like it.
Oh,
So,
there is one, Matt.
oh, where is it?
Morgan's just put one in.
Morgan's put one in.
Ah, okay.
How do
Brilliant.
vaccines play a role? I think she's popped in there.
I'm assuming that whoever put that in is thinking about vaccines in cancer. And I mean, there's a huge amount of research around this at the moment. I mean, everyone will be familiar with the COVID vaccine. The mRNA vaccines were actually developed by a company that was working on cancer vaccines before the COVID pandemic. So there are trials ongoing, in the UK on cancer vaccines. They will be another tool in the toolkit of treating cancer alongside the other systemic anti-cancer therapy. It will feed into the fact that there are more people living with and beyond cancer who need the services of entities like Perci Health and will need the support of a full multidisciplinary team. Anyone else got any thoughts on cancer vaccines?
I guess as well, I think we need to, I guess Lisa can probably talk to this better, but just thinking about there is a little bit of especially around the younger generation, about a bit of fear about vaccines in general from COVID. So
Yep.
whether the messaging around introducing these things needs to be right for the younger generation so that we can get actually people to take these things up if they're beneficial as well.
I think also it kind of speaks to that preventative approach as well. I think quite often at the moment we might be in more of a reactive situation. So I think, the fact that we're trying to focus more on prevention, that's still something that's maybe not necessarily embedded enough in our society, and thinking ahead to the future and trying to prevent things from happening and risk reduction.
These are really good questions. So thank you to the questioners. Do we know whether there's a critical window, for example, childhood, adolescence, where exposure to risk factors has the largest impact on future cancer risk? Wow.
Question.
I think,
Yeah, I was going to add that just what we know about breast cancer risk from epidemiological studies is that populations that have, say, more soya in their diet in childhood have reduced risks of breast cancer. So we know that there is some interplay with future risk and diet. But I think it is still quite an unknown area. But that's something that's quite interesting, and especially because there's still a myth about consuming soy products and risk of breast cancer, which is a myth. So that studies that look into that area are quite interesting.
Yeah, it's very tumor dependent, isn't it? So
It
you can
is.
think about HPV, human papillomavirus exposure in young women and cervical cancer, hence why, and this goes back to the, vaccines
Mm.
as well, right? That's why
Mm.
that vaccine program was brought in through to, lung cancer and smoking. There's different trajectories. Um, I think the bigger overarching perspective is, and this was highlighted in the report, that actually it's raising the awareness of risk and what those risk factors are so that behaviors can modify in response to that. Right, there's quite a few
Just
questions.
on that, actually, Matt, there was a big thing on LinkedIn yesterday about Australia and how they're trying to encourage young men to take up the HPV vaccine
Yep.
because obviously, if we can prevent them being exposed to the condition, then we'll reduce risk in men as well.
We're going to take one more question, and I think this is a good one. So if each of us could make one change to national policy to address early onset cancers, what would it be? Go round. So Lisa.
Ooh, that's a really good and hard question, actually. One change to national policy. I think it is, for me, communication. I think opening up more communication about talking about cancer, about how cancer
Yeah,
is changing. It's no longer a death sentence. People live with cancer. I think just encouraging that message more and that it is treatable, it's
yeah.
manageable. I think, yeah, that would make a huge difference in my opinion.
Thank you, Joanna.
I think about screening, really, just putting it higher on
Yeah,
the agenda of screening and also reviewing the screening protocols that we have in place and like seeing how we make that, for younger people so that we're picking up cancers more quickly in the younger generation.
Sarah.
Well, I think the national curriculum should
Mm,
have lots more
Yeah.
formalized about health, about good
yeah,
diet. And we need to adopt, I think, the same approach that there is probably in Italy. And, I stayed with a chum whose children were at school in Italy, and the difference was huge.
yeah.
So I think the national curriculum has a responsibility.
And my change would be around physical fitness, and I think we're a really sedentary population, and that increases risk, but it also leads to worse outcomes in lots and lots of health measures. The COVID pandemic was a perfect example of how we did worse compared to other countries because we're just more unfit. We need to get fitter. I don't know how we'll do it, but that we just got to encourage it. So that's the end of the webinar. I mean, thank you so much to the panel. I really enjoyed that. It's been recorded. You're going to get the link sent out to the report. So have a look at that. Have a look at Perci Health online. Um, I think we're going to repeat this and look at a different topic, but it's been really great today. So thank you for giving up your time.
Thank you, everybody.
Thank you.
Thank you.
See you later.